This meeting is being recorded.
Welcome to Dental All Stars. I'm Eric Vickery, President of Coaching at All Star Dental Academy. I'm so excited to interview our guests today, our coaches, Gregg Raymond and her husband, Dr. Gregg Raymond, two of our All Star Dental Academy certified coaches. And I want to give you some background on each of them before we get started today. We're going to really focus on how to utilize your entire team to achieve not only case acceptance and patients saying yes to moving forward, but large case acceptance, getting them healthier faster. So let me give you some background on Dr. Gregg Raymond. He graduated from the Indiana University School of Dentistry in 1977 and established his solo practice in 78. He completed hundreds of hours of continuing education courses, including Dawson and Pankey, PAC Live, Greg, right? LVI, Advanced Dental Studies. In addition, he proudly earned his fellowship in the Academy of General Dentistry. He's done it all, folks. And Dr. Raymond believes that a strong team was vital to the success of his practice. He and his team attended numerous seminars on leadership, team building, and communication skills. Dr. Raymond excelled at cosmetic and full mouth reconstruction, and he often used conscious sedation at the request of his patients. He was successful with completing large cases without reliance on dental insurance, and the practice rose to the top 5% of dental offices in the United States. In addition, he was a speaker for Dental Boot Camp, where we met, and the Coaching Center. He also enjoyed coaching dentists on their goals and vision. Because Dr. Raymond's highly regarded reputation, he was invited to speak at the Greater New York Dental Meeting on how to become famous in your hometown and the 7 secrets for case acceptance, which hopefully we'll tap into today. And his lovely wife and fellow coach of mine and friend, Gregg Raymond. Gregg Raymond graduated from Indiana University with a Bachelor of Science in Health Information Management Administration in 1977. I see where this is going. I see where you guys met here. I see what happened. Yeah. She began her career at the Indiana University School of Dentistry as Director of New Patient Admissions. This is like a match made in heaven. In 1981, Karen began her position as Patient Relations Administrator in her husband's dental office. She and Dr. Raymond quickly realized the importance of empowering their team and attended numerous seminars and workshops on team building, trust, and leadership. Karen became a passionate presenter for the Dental Boot Camp Master's Program and inspired doctors and team members to set their office and personal goals and vision. Karen particularly enjoyed teaching enhanced communication skills between the dental team and patients, including transitioning a new patient from the initial phone call and subsequent appointment to accepting their treatment plan. She is excellent at coaching teams on becoming insurance independent by handling patient objections and offering various financial arrangements. So we're going to talk to, a couple mastery coaches that we have here at All Star and get focused on team case acceptance, large case acceptance. And I want to just preface this with, we're ramping up for our All Stars Practice Growth Summit in May. It's May 19th and 20th in Lago Mar Beach Resort and Club in Fort Lauderdale, where we're going to spend 2 days building your team towards just having just confidence in themselves, but then how to also deliver on communication skills for the patient, from the phone call, the great call process, to case acceptance, to handling objections, to stopping cancellations. We're going to do the whole thing over 2 days. And so this is really I want to emphasize that, but I also want to emphasize Dr. Raymond and Gregg Raymond on their skills as coaches. They're working with clients. They love doing what they do. And so we're going to really allow them to give you some great verbiage that they teach their clients, and really have you tap into their knowledge, the wealth of knowledge. So welcome, you guys. I want to discuss this topic with you guys for a while, and I really want to get your insights in helping dentists out with case acceptance and getting patients to say yes and getting healthier faster. So thank you so much for joining us.
Thank you, Eric. We love it. Thanks.
Oh, that's awesome. That's awesome. You guys are the best. So
we moved up to the introduction.
Yeah. Yes, and I did have to I had to shorten them. They're better than that. I shortened the introduction for the podcast. So listen, I want to jump right in, and I want people who are listening to this to feel like, wow, that's a great coaching tip. I really want to take that and apply that with my practice. So let's do some podcast coaching today. So let's just jump right in, and you guys just bounce off each other, piggyback one another here. But what would you say, made the biggest difference in just in presentation, or what was different about your approach that increased case acceptance, both large and small for you guys? What would you say are the things that worked best for you guys in helping patients say yes?
Go ahead.
Oh, okay. I guess I'll begin. Gosh, Eric, I think the research, it began with the new patient phone call, and I liked seeing new patients either at 8 o'clock in the morning or 1 o'clock in the afternoon. So we goaled our schedule to see 2 new patients per day. And at our morning huddle is really where it kicked off. And our team members, we would sit at our meeting table in the mornings and go over the profiles and the disc and all the research that our team members have gathered off the phone, our great phone call.
Yep.
And then we would discuss that and in great detail, not too long, but just kind of to the point of each new patient's desires from what we gathered from the phone call. And then after the huddle, at 8 o'clock, I would meet with the new patients, with a new patient in a consultation room, just sitting across from each other at a consult table, eye to eye, and I would just listen primarily, and I would verify the research, and I would say, I understand that, my team member said this is what your main interest is, and correct me if I'm wrong. And I would just briefly go over that and just verify that, and also paid a lot of attention to their disc, because the D's I treated with a lot of brevity, and the S's and the C's I treated with a little bit more story and a little bit more time. But I dedicated, here was a key, is that I didn't meet our new patients when they were sitting in the dental chair. I set them in a consult room and took the edge off. They weren't sitting in the dental chair. I was sitting knee to knee, basically across the table, and it was just one-on-one. And I listened, and it was a great technique I found to build rapport and trust with that patient from the very, very beginning. And eventually we got down to, I'd kind of tease, it depends on the disc again, but I would say, I don't know about you, but I hated going to the dentist, and we would swap stories, and I'd tell them my personal nightmarish dental stories. And as a child, I had a lot of cavities. I had a lot of mercury silver fillings in my mouth that broke, and most of the adult, I love the adult patients, especially for large case acceptance, because they could relate to that really easy, and they were going, oh gee, I have a dentist that gets it because he's experienced this himself. And so I would say that, and I'd say, I understand. I go back to the research, and I would use that research sheet that our team members had filled out, and I refer to that. And then finally, I would get around to the permission statement. I'd say something like, Eric, if it's okay with you, I would like to go ahead and do our examination now. And I'm going to have Karen come in and seat you in the treatment room. And if it's okay, I would like your permission to make sure I share with you everything I see from your x-rays to your oral examination. I'll use a little camera, and we'll go over that, and I won't hold back, and I will let you know everything I see. And of course, once I share that with you, you can do whatever you would like with the information, and you can tell me what you would like to do to move forward or not move forward. Everything is totally up to you. So there's no pressure whatsoever on yourself. And if you have any questions at all, I just want to build a great relationship with you and treat you like your family, like you're my brother. And I'll let you know from there, how's that sound to you? And so that's how we kick off.
Eric, yeah, I can't tell you the difference this made. When we went to a seminar, it was dental boot camp back then, and we were sitting in the audience with our team, and they presented this idea of building trust and actually taking an hour with a new patient, and instead of starting them in hygiene, the typical, and the doctor comes in, the patient's laying back, hi, doctor. How that is. It's so uncomfortable. and so impersonal. And I'll never forget when they presented, okay, we would like you to take an hour, a half hour, 45 minutes. We want you to get to know your patient, to build that relationship, to build that trust with the research. As he said, it starts with that phone call, getting all the research and the patient being treated so special all the way through. I'll never forget the gasps in the audience and Dennis saying, I can't afford that. How am I ever going to afford, allowing all this time? This is just not going to work. And we decided we need to give it a chance because, as you said, Gregg has been through, and the team, we went through all this advanced training, and he was able to present. Back then it was a big deal, $40,000 case, and patients would look at him like, oh my gosh, have you lost your marbles? And then they would see him again, like that was the end. I'm exaggerating. But when we started this, it was like magic, and the case acceptance just went up, and it was building that trust. I can't say enough. And then when we later taught it, I tried to instill that in the doctor, that it's so worth it. That time will change everything. And of course, not every patient, but the stories that we heard and the things that happened and the people that came in there shaking, they would leave so happy and hugging people.
There's a connection there. And I think white coat syndrome is real. They have a fear, and you're breaking down those barriers psychologically when you know how to communicate with your patient. So I want to go back, because I've taken great notes from Dr. Raymond and from Karen here. And I want to, for those listening, here's some systems. First of all, the new patient we already know is a loss leader. We already know that. How much of a loss leader will depend upon how much time you're spending and how you invest in them. And so exam typing and doctor time and how we schedule this so that you're not completely abandoning the ideal scheduling blueprint and still be able to do this. Having a consult room and being able to meet the patient in a safe place. Many of my clients that do large cases, they understand this concept that doctor time spent building relationship first is key to overcoming that loss leader. And I don't know what the saying is, but basically opportunity is always on the other side of risk. The bigger the opportunity, typically the bigger risk involved. And so you were willing to take that risk is what you're really referring to, which I love. Some systems that you mentioned, the law of research, where you took at the morning huddle, you took that great call sheet and you as a team talked about this patient that you guys did on the phone. Karen, you were able to connect with them on the phone, spend time with them in a way to build rapport and engage and do the things we talk about. But what we're talking about there is a law of research, which means when doctor walked into the room with the patient, you didn't say things like, so what brings you in today? You already had information to build credibility. And so you came in as an authority, as somebody that they saw as credible. And you said, wow, they really know what they're talking about. So for those that are listening, you guys were implementing these systems really well. DISC was all about understand their DISC, their personality profile, but adapt to it. I love that you said that. It's not just, hey, I know my DISC, I know their DISC. It's how do you adapt to them? The one communicating with this person is the one adapting, meaning the dental team. And you were using your body language to build rapport. You weren't intimidating. You didn't have this, loops on hovering over them as you met them, all of that, which is great. And then your permission statement you gave was beautiful. Getting permission to tell them what you see and giving them permission to be in control. So I love that you really live the skills that we teach. And you guys are just a walking example of why, when you implement these skills, you create a successful practice.
Yeah, it's true.
Yeah,
it is.
Well, we have to put it into our own wording, not scripting.
Yeah, exactly.
You get the point across, and you can tell how the patient is receiving that. And just what you said, being flexible, being adaptable, and just letting them know they have a trusted friend to provide their dentistry, and putting them in control, I think, is so key. Whatever you decide to do, whatever is going to be fine. It has to fit. I would even say to the patients sometimes, this has to fit with your lifestyle, meaning that it's going to fit with your time, your economic, situation. And we have a great team that can adapt anything, anywhere. And our team are experts at whatever your needs are. Just let them know. They'll make that happen.
Empowering the team. So let's shift to the team. So, we have a team of coaches that we use. And so I'm doing these podcasts, interviewing all the coaches for you guys to shine, but show people who you are, but also to give some coaching tips. And I had the interview with Jen already, and there's already so much similarity in these successful practices and situations where, hey, when you implement it, really works. So let's talk about the team, because we talked about the doctor now. So how do you guys use your team, or maybe even specifically your hygienist? And I'll preface this word selling. we are selling, right? And our favorite original mentor, Walter Haley, said, if you don't like the S word sell, get used to the B word broke, right?
Yes.
And there is no profession that doesn't sell. It's selling the right way that is key. It's selling in a way that is not pressure filled and forceful and makes you feel yucky. It's selling in the right way. So how did you get your hygienists or team members to set you up well so that they were getting the patients already wanting to move forward with things before you ever even showed up? How did you do that, maximizing the team's efforts?
Well, specifically with hygiene, we had a great hygienist. And one thing, a comment about team, is that placing the right team members in the right positions in the office is so key too. There, for instance, from admin to assistants to hygiene, finding out the team members' strengths and where they are comfortable with speaking to patients and functioning, I think is, first of all, very, very key. But specifically with hygiene, Heidi was my hygienist, and she would call me in for an examination at the end of the hygiene visit. And on the screen, what really, really was so powerful was images from an intraoral camera that she used on every patient. She would just do a scan of their teeth and this and that. If she found like an old mercury silver filling that was cracked, or a crack in a tooth, or whatever the situation was, she would have it on the screen. And she had already spoken to the patient about, I want to make sure I show Dr. Raymond this condition that you have, and see what he would recommend. And she would pique the patient's interest before I even entered the room. So that basically, when I did enter, and then she would say, Dr. Raymond, I'm concerned, and I spoke to Susie about this crack, and what do you think? Do you think that needs a restoration, or you think this should be how urgent? And I would always say yes. I think this is very urgent, and we, Susie, would you be willing to move forward? But basically, I know in boot camp we would get down to having the hygienist would be so tuned in that all the doctor had to do is say, and yeah. It's not that the hygienist is diagnosing. It's not that the hygienist is making the formal treatment plan. It's just that you're confirming with her findings. And I trusted Heidi quite a bit. She was very seasoned and very, very good at what she did.
Well, you guys are on the same page. She's thinking like you.
Yes, yes.
Absolutely. So three things I want to reiterate for those listening. StrengthsFinder. That's something that I'm passionate about, that I'm certified in, that I love helping offices with. So StrengthsFinder 2.0 is a book you can get. You can have your team take the test, and you'll find different skills. Some people are very analytical and they love structure and getting things organized. Maybe a good scheduler. Some are great with communication. My number one strength is communication. My second is called winning others over, which means I love communicating. Put me in a position where I can do that. So there's 34 different strengths that you want to have access to. And you're exactly right. You found them naturally. You guys put people in the right places and set them up for success, which makes them want to do it more. I love that. The other thing you talked about was intro camera. And in that you talked about, I am concerned, where what we teach in coaching is focusing on the condition. And I heard you say that multiple times in that. And the scanners now are so crazy effective with showing the patients their mouth and having the patient point to things, look at wear on the lower anteriors and all those things. So we want the patient to buy into the problem before they'll ever buy into a solution. And lastly, you talked about being set up. Transfers can be very powerful if they're done the right way. And setting you up for success means knowing what to communicate, focusing on that condition again, and letting the doctor know when the doctor walks in, hey, patient's concerned about this. Yeah, that's good. So Karen, what would you add?
I would like to add just a little bit of a story just about Heidi. She came to us from Ohio. She had worked in a small hometown practice where they did not do any type of perio. It was cleaning. Every patient had 30 minutes for cleaning or 45. So she came to us and we immediately loved her, and we had our team go to lunch with her, and we took her on. We hired her, and it was such a good hire. However, once we realized that our perio program was not going anywhere, she and I went to a perio course. It was like a 2-day weekend out in California. And she learned so much that she didn't know, that the doctor had never emphasized, hadn't talked about. She learned how to talk to the patient. She learned how to treat that. And we talk about not only just power. First of all, she had to change her beliefs. She learned this knowledge out there, and we put it into practice. Obviously, it didn't happen overnight, but the growth of our perio program and her strength as she continued to do that and encouraged and saw the results, it was just really wonderful. So I always encourage team. I guess we just had so much success with taking our whole team and sometimes individual for certain things, what that can do. However, when you get back, you have to have action steps. It has to be done because it's too easy just to come back and talk about it. So that really started changing our practice.
That's great. Yeah. Action. Knowledge is power. Not really. Unless there's action, then it is. Potential power is what Alex says. And so, yeah, with the tracker, Karen, when we look at clients, we see what the perio percentage is in the practice. And look, maybe every stone is turned and they are looking for the perio, and it's not there. But most practices, we want 30 to 35% or more perio in their practice. So that's why we have our coach, Lynn Dousvoice is a retired hygienist with her MBA on our coaching team. And she has a perio program available to everyone listening, all the All-Star clients who want to have a coach work with them on their perio program. She'll come right into your practice. She'll do it virtually if you'd rather, and help you. And it makes a total difference look, just on a side note here, we have to understand that your patients are getting older. Their blood pressure could be going up. Their cholesterol could be something they got to watch. And their perio is something that they have to understand is connected as well. So don't feel like you have to be a prophy machine all the time. Your patients will understand if you communicate it properly. And it sounds like you guys did a very similar program that we did in California for perio. Loved it. So good to turn your practice around in that regard. So that's awesome. Okay. So I want to go deeper into this team members in the right position, right? So, you're presenting $40,000 cases. You have to be comfortable with this. And so, you got everybody in the right place. Everybody's confident. They got the right verbal skills. But how do you actually present them to feel like it's not selling? The patient to feel comfortable moving forward. Team members are saying the right things. What are those things? And so how do you not push a patient into it, push sell, but how do you get them comfortable really saying yes to large amounts of dentistry so that they get healthier faster? It's a win-win.
Well, large amounts of dentistry in our practice, I know some doctors do not present fees very well, or they're a little intimidated by presenting a 40, 50, or whatever amount of dentistry. I became comfortable with that and using the permission statement, knowing that the patient, and I would repeat that too, on our treatment plan presentation appointment, could be at the same appointment, or it might be that I would have them return and do the treatment plan presentation. And they always knew all along that they were in total control. And I would always say, listen, this has to fit with your you're busy. I know all of us are busy. You have a lifestyle. And I had to keep in mind always, too, if I was turned down from the whole, like a full case rehab case, a no today didn't mean never. It just meant that this isn't the time for that particular patient. And that's fine. I want to keep them in the practice, take care of any emergency or any urgency needs, and then return to that conversation later, because then it might fit with them better, either their lifestyle or economically for them. So they were always in control of that. But I think the team, as far as putting the team members there, we had a few assistants that were very intimidated to present a treatment plan that was like over $1,000. And so you had to find out if that team member is comfortable presenting this $1,000 treatment plan, or maybe someone is at $5,000. I found in my practice that $5,000 mark was usually kind of a rule that assistants in particular, I'm not picking on assistants at all, because some were comfortable doing it, but I found that I didn't want to put them in a position that was unnatural for them, because it wasn't helpful for anyone. But as far as selling, they certainly have to buy into your vision about helping patients get better and get healthier. And you have to show them how this works in the practice. And a lot of that came from taking the whole team to seminars and to meetings, involving them in all the continuing education classes. And it was an eye opener for many doing it that way.
Yeah.
But I don't mean to be rattling on, but putting the right team member in the right position is so they aren't.
The recording has stopped. This meeting is being recorded.
So it was making it natural for them. Let me just put it that way. Once they understood the vision and the concepts.
Yeah, you froze up there for a second, so I just paused the recording for a minute. So Karen, but you wanted to add something, I could tell. Thank you, Dr. Raymond. What did you want to add as far as getting everyone comfortable with the patient getting comfortable saying yes? What was the secret sauce?
Well, I think as when it came to presenting treatment, especially if we were talking about maybe a few thousand, whatever it may be, the person that's presenting it to them, they do need to feel very comfortable and believe totally in it. And they want to engage the patient and not be afraid of questions. We get so worried if they ask a question that means a no, or if they say, well, I work or I do this, I don't see how. And then you say, well, would it work if we made it available, or would you like to come a lot or just a few times? And it was amazing if you just talk to the patient like a friend and find out about their lifestyle, that you could get things to work. I'll never forget. This friend of mine was telling me about an orthodontist that she had taken her son to. She said the orthodontist took 30 minutes to present this case to her. And she was so busy and he wasn't paying attention to her, like that she needed to get out of there, that it was not good. Yeah. She did not accept the treatment plan. She actually came to us and was complaining about that. So reading
she spent more time going to another dental office just because that guy wasted her time. Yeah.
Exactly.
Yeah.
And so that's how important reading the patient and what we're talking about with their disc.
Yes.
And the person feeling comfortable and realizing the questions people ask are not objections.
That's right.
As an objection.
Yeah, you're engaging in their conversation. This is what I wrote down. You have to be, as a team, be comfortable with questions and how to engage that patient almost as a friend. You're trying to figure out with them what's keeping them from getting there, and seek resolution with them, not in opposition of them or pressuring them. And you use questions to do that, right? Yep. Use your questions, your leaders and trailers, you're answering question with a question. And all those skills are learned over time through practicing and coaching, I presume, right?
It does. It
Absolutely.
takes time and it takes practice. And we actually did role play with our team members, especially when we were learning new skills, because it can be so uncomfortable to try something new. It's a risk. You're scared you're going to get rejected or you're going to look like a fool, make a fool of yourself. So
yeah, I love that Dr. Raymond said, when you hear a no, it's just not right now.
Exactly.
Right.
It doesn't mean no forever. And so don't take that personal. I think there's such a fear of rejection that we have to deal with ourselves. You know, me, anybody, we all have some level of fear of rejection or approval addiction. And you're constantly working on it. You're constantly talking yourself through it, and self-belief and being confident. So Karen, what do you think when imagine you're coaching a client right now and they're saying, what do I say? How do I get them to say yes? What do you find are the words that you use consistently? You know, we heard permission statement, we heard focus on conditions. What is something that you say is, look, when we went back after being trained and coached and all this, we went back and started doing this thing, and all of a sudden patients were saying yes more. What was a difference maker in your practice?
Well, I think going back to what their emotional feeling was.
Their why.
Their why. Thank you, Eric. Couldn't come up with that.
Yeah.
But their why. And sometimes it will really even come out more when you're doing that consultation and you get to know more, because usually Gregg would always find out the emotional why, but sometimes it would come up there, and then they would start talking about their experiences. And then again, Eric, what you said, you just get eye to eye with them saying, you know, what is your dream? We can make that happen. I know that sounds like something that you've dreamed of and that you don't perceive, but if we can do this for you, do you see any reasons that you don't want to go ahead with this? If I can help you find a way to fit this into your life and your budget. And just, you know, going back to that is
so good.
And understanding their life.
I think people are going to think that we script these or that we plan these out. These are not planned conversations. These are authentic questions. And the reason I say that is because I asked the same question to Jen for her podcast interview. And guess what her answer was? Finding the why, creating an emotional connection with the patient and doing the emotional exam and finding what their why is. And here's why this is so important. And I love that you said that. I'm so thankful, Karen. People buy for their reasons, not your reasons. And if you don't know why they're here, if you haven't taken the time to connect with them, right? We're in the tooth industry, but we're in the relationship business. If you haven't connected with them and realize it's not a tooth walking through the door, you're missing out on an opportunity. It's probably why people don't feel connected to you to want to move forward with you, and they feel pressure from you. When you truly understand them, they feel that connection, that relationship that builds. So number one, thank you, Karen, for saying that. Number two, what you did was you said, we're actually asking the patient if they want to move forward. What we hear all the times from doctors is going back and realizes, wow, almost 2/3 of dental team members in dental offices, we never ask the patient if they want to move forward. And it's a simple thing to think about. And Karen, you gave such a beautiful example of that. You know, how can we help you get this taken care of? It's such a beautiful way to say that. I say, how do you feel about moving forward with this? I don't know, Dr. Raymond, did you have a way that you asked patients about moving forward? What was your something you were comfortable with?
Well, I usually just prefaced it with going back again to the permission statement. I say, you know, Eric, you know, whatever you decide is going to be fine. Yeah. And whenever you decide to do anything, if anything, is fine too. Is there any reason why I know you're concerned about X, Y, or Z?
Yeah, the condition.
Is there any reason that would get in the way of us not scheduling an appointment to help you take care of that condition?
Yeah. Yeah. So you're really putting the onage on the patient and saying, it's your call, but is there any reason why you wouldn't want to get this problem taken care of? Yeah. And then they'll ask, how much does it cost? Then we go into all that conversation, right? Yeah. Mm-hmm. Karen, or talk about it if you want. So this has been really good, guys. I really, really appreciate this. We could talk for hours and hours and hours on this, of course. And we love helping those of you that are listening. We love helping clients Dr. Raymond and Karen, you're a dynamic duo. You get two coaches for the price of one here. So this is amazing. Thank you both for being on here. And I love your expertise. I love your history. I love your marriage. I love how you guys are so connected with each other. And I'm sure there's things that we want to say more. There's only so much time on this podcast. So I appreciate you guys. Is there any one more thing that you want to say, like, oh, one more thing, or do you feel like we covered enough?
I think we've covered quite a bit.
Okay.
Right?
All right.
Yeah.
Good.
I guess one thing I would say, if you have before and after pictures of cases you've actually done, especially when it comes to full mouth reconstruction and having patients look through, we had a scrapbook of before and afters in our lobby, and we had it in our consultation room, and we'd have patients looking through that, and it would be like a lot of them were going, wow, that's really good, whether it's cosmetic or full mouth or even quadrant dentistry, where they had some silver fillings like in one quad, and we converted them to inlays, onlays, crowns, or whatever, and made them stronger and healthier, and showed pictures of actual cases that we did. And all the pictures we had in our office, we emphasized these are actually pictures of our patients that we had permission to show. So I think that was I put that out earlier, but I think that's a key component.
Well, Heather would call that sharing the sizzle. And it's okay to brag and create credibility. They want to know. They have no idea. Are you good at what you do? They're trying to figure that out. So how you answer the phone, how you connect with them. These are all things in the rapport building that create that credibility that we're looking for. So it absolutely connects. I've had offices have their screensaver on their computers while they're out of the room. The patient's just sitting there looking at the screensaver go through with that quadrant replacement or the full mouth, the smiles, or even just a screenshot of a written testimonial, headshots of before and afters. Those are things that have to play a role in your practice. And one little nugget I'll share, and then we'll wrap up here, is also have condition photos and consequence photos. So have in your intraoral library other patients who you diagnosed with a fracture or that amalgam, and they said no. And then they showed up a few months later in an emergency situation. It's just a picture of that tooth, not their face. And you show a perio abscess or a broken tooth or a vertical fracture or whatever it is. So you can show this patient what's coming. They don't know what you know. And that picture's worth 1,000 words. Share that with them and show them. So,
Exactly.
All right.
So true, Eric.
Great ideas, guys. Love it. So for those of you that are listening, if you like this, what we're talking about, we've got really good news. We have coaches who will train you on this. We have our May event coming up for practice growth, meaning you're an established practice. You're already doing really well and you want to take it to the next level. You want to grow it. You want to achieve the practice of your dreams. Well, there's always that 5%, that 10% more that you can do. And it's typically in areas like this where you're communicating and connecting with patients. And so that's what this program is going to be about in May. It's going to be May 18th. It's actually going to be May 19th and 20th in Fort Lauderdale at Lago Mar. And this is for All-Star members. And so if you're an All-Star member and you're listening to this and you want to bring your entire team, I think, Dr. Raymond, you would agree, bring your entire team, right?
Absolutely. Bring the team.
It's a 2-day event. You'll see Gregg and Karen there. They're going to present. They're going to do their thing there as well. You'll see all the coaches. You'll see Larry Gazzardo. You'll see myself, Eric Vickery. We'll all be presenting. We'll all be doing something. Robin's going to be there doing her thing as well. It's going to be just an amazing, amazing time to grow your practice, no matter what stage your practice is in. So if you like that, just reach out, email Heather at allstardentalacademy.com, and she will get you taken care of. If you want to work with coaches like Karen and Dr. Raymond here, just email her. She'll get you set up with them. I'm sure they would love to help you. Thank you guys again for joining me. I really appreciate it.
Thank you.
So
Our pleasure. Thank you.
All right. And for those of you that were listening, thank you so much for joining us and taking the time to invest in yourself. We really, truly appreciate your time. We hope that this makes an impactful difference in your practice. So until next time, go out there and be an all-star.